So do you have a lot of pain in your heel, in your Achilles tendon when you jump, run, etc.? When you're doing any activity? Hi, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to another video. In this video, we're going to be talking about heel pain or Achilles tendonitis. So what is Achilles tendon? So it's a very fancy word. Achilles tendon is the strongest tendon in the body. So what is a tendon? A tendon is a structure that connects a muscle to a bone. And the structure that connects your calf muscles to your heel is known as the Achilles tendon. And why? It came from Greek mythology. Achilles was somebody who could not be destroyed or killed. So what the gods said, that you dip him into this lake, whatever part of the body touches the lake cannot be destroyed. So his mother held him by his foot and put him into the water. And the only part that did not go into the water was the Achilles tendon area. So Achilles was defeated only when they cut his Achilles tendon, and that's why it says Achilles tendon, most important tendon to walk in your body. Now this is a very thick fibrous band that attaches onto the heel, and it helps you put your foot downwards. We call it plantar flex your foot. Now this particular tendon can get inflamed. Now tendons are like clotheslines. So think about clothesline where you dry your clothes. Now the clothesline is at a particular tension between two walls, right? So when you hang on a clothesline, the maximum tension is where the clothesline is attached to the wall, right? So same thing, the maximum tension on a tendon is where it's attached to the bone. So if the muscles are weak, if you are in an activity that involves a lot of standing, jumping, running, etc., then the chances are that where this tendon is attached to the bone is under a lot of stress, and that can lead to inflammation and eventually Achilles tendonitis. Some people with foot deformities like flat feet, etc., who don't wear the right footwear, hard footwear regularly, or footwear which pinches against the Achilles tendon where it's attached to the bone, can also lead to this problem and pain. Other circumstances where this can happen is uric acid. So when uric acid is excess in your body, especially people that drink a lot of alcohol, a lot of red meat, cheese, etc., these crystals get deposited on the Achilles tendon insertion and can cause a lot of pain, redness, etc. Now, when this is there, what is the treatment? Initially, rest. Ice it if it's just started. Still doesn't improve, go show your orthopedic surgeon, let him evaluate you. He may do some ultrasound, etc., to see that you don't have any tear, you haven't injured it. If that's not there, it's just tendonitis, he'll put you on to physical therapy. Now, physical therapy is divided into two parts. One is something called modality-based treatment. So stuff like ultrasonic massage, deep heat, laser, etc., which they'll do onto that area to help, blood circulation improve there and healing to happen. And then they start with strengthening exercises and correct the root cause of the problem, like, weak calf muscles, etc. If it gets okay with this, great. Still doesn't get okay, then the solution is giving injections into this insertion. So what are the injections? Mainly either steroid injections or GFC or growth factor concentrates and PRP. So what do? They act as anti-inflammatories. So that inflammation which is chronic, which is not settling with just normal physiotherapy, etc., settles. Some home remedies, what you could do is, if it's early on, ice packs, later on heat pads help. Taking a little lukewarm water, putting a little salt in it, dipping your feet. Sometimes using insoles and proper footwear like sport shoes helps. Also, if things still don't get better, sometimes they get x-rays done. Now, where the Achilles tendon attaches onto the heel, sometimes there is an excess bone growth that could be irritating this Achilles tendon. We call it a spur. In these circumstances also injections help, and in rare circumstances removal of this bone spur. I hope you got a lot of information in this video about Achilles tendonitis, how is it diagnosed, etc., what are its symptoms. If you like my video, please like and subscribe to my channel, and please follow me on Instagram. For those who like Hindi content, we have a very popular silver button Hindi channel. Please like, subscribe, comment and follow the channel. And those who have any queries and want to meet me, please get in touch through the numbers given there and we'll be happy to see you. Thank you.